Most families I work with are absolutely certain about one thing. When the time comes, Medicare will pay for everything. And 9 times out of 10, the time comes and Medicare doesn't. Not the way they thought, not for the things they need. And by the time the family finds out the truth, they're not learning at that point. They are scrambling. Today, we are going to make sure that you are not that family. Welcome back to Gentle Shepherd Care Weekly Webinar. I'm Emma Soy. I'm a registered nurse for the past 35 years. We do specialize in neurological care, and I'm the founder of Gentle Shepherd Care. We are a nurse-led elder care planning and home care firm. So today we're going to have a conversation about Medicare. We're laying the foundation, what Medicare was built for and what it actually pays. Next week, in part 2, we go to the gaps, what Medicare won't cover, the 100-day myth, and what to do about it. I do have a disclaimer, though, before we start. This is just for education. This is not legal or tax or financial advice. For your specific situation, work with a licensed professional to be able to help you. Today, we are just laying a framework. Here's what we'll cover: the difference between medical care and long-term care, the 3 buckets Medicare actually pays for: hospital, skilled nursing rehab, and home health. And so there are 2 completely different things that often get confused: medical care and long-term care. Medical care is acute, it's episodic, skilled. For example, a surgery, a diagnosis, a rehab stay. Medicare was built for this. Now, long-term care is help with the ordinary things of life, such as bathing, dressing, eating, walking, supervision when memories start to slip. This is not what Medicare was built for. Medicare was created in 1965 to cover hospital and physician costs for older adults. The architects of the program were not designing for a country where people live up into their 90s with chronic conditions. So here's a quick orientation in case anyone needs it. Part A, for example, is hospital and limited skilled nursing. Part B is doctors and outpatient. Part C is the Medicare Advantage. It's the private plans that bundle A and B with usual D and extras. Part D is prescription drugs. So when you hear me say Medicare, know that I'm talking about a health insurance program, a good one, but not a long-term care program. That distinction is the entire foundation of what we are building over these next 2 weeks. And so we have buckets for you we want to start with. Bucket number 1 is hospital stay. The hospital stay is what we call Part A. That is inpatient hospital stay covered after your deductible, full coverage for the first 60 days, partial coverage with daily coinsurance after that. Verify to see your deductible for the year and your coinsurance amount. Verify with your insurance, with your coverage to see what that is. Watch out for observation status. Even when you are physically in a hospital bed, you may be classified as an outpatient. An observation does not count toward the inpatient stay requirement that we'll be talking about next time. Bucket 2 is the skilled nursing facility that is up to 100 days. This is where most families come unstuck. There are 3 conditions, and all 3 must be met. Condition 1, a qualifying hospital stay must be admitted as an inpatient for at least 3 consecutive midnights before skilled nursing facility stay. Observation status does not count. Condition number two, the math. Days 1 through 20, Medicare pays the full skilled nursing benefit. Days 21 through 100, there's a daily coinsurance. You need to verify the amount for this year, but I think in 2025 it was about $209 a day. Condition three, you have to keep needing a skilled service, skilled nursing or skilled therapy. The moment a clinician documents that you have plateaued, the coverage clock can stop, even if you still very much need help. So when you hear Medicare covers 100 days of nursing home, what's actually true is closer to Medicare may cover up to 100 days of skilled rehab after a qualifying hospital stay, as long as you keep showing skilled need. That is a very different sentence. The third bucket is home health. This is the one most families assume covers a home health aide all day long, every day. Let me remind you, it does not. To qualify for a home health aide, your loved one must be under a physician's plan of care, required intermittent skilled nursing or therapy, and your loved one has to be homebound, meaning leaving home requires a considerable and taxing effort. When those conditions are met, Medicare pays for visits. A nurse, a few times a week, a physical therapist or occupational therapist, and as part of that benefit, a home health aide may come for a visit a few times a week, but only as long as the skill need is active. And usually, when the home health aide comes, they only have time, probably most likely, for helping with showers. So that is why you see the home health aide comes, they actually focus on personal care, helping you be up. And so it's just a skilled nursing visit. It's a home health aide visit. So they're not there for any period of long time, like 2, 3 hours. They're not there for that long. When the skill need ends, the home health aid services are also over. This is the part that surprises most families. And two more you should know about. We have hospice, which is part A, for terminal diagnosis with a 6 month or less prognosis. It's covered comprehensively. We'll go deeper on hospice and later on when we cover hospice. Doctor visits, outpatient services, durable medical equipment are covered under Part B. So Medicare will absolutely show up after hospitalization, after a fracture, after a stroke. It will pay for skilled help. And for a lot of families, that is a meaningful benefit. The question we have to answer that we're going to cover next week is what happens when the skill is no longer needed, but the help still is? And so this is where we're going to be covering for you next week. Before next week, though, do one thing for me. Pull your loved one's Medicare card and confirm what plan do they have. Do they have original Medicare? And or do they have a Medicare Advantage? They have different rules and different appeal path. You need to know which one is on the card before we walk into the gaps next week. So that's your homework. Until we meet again next week, take a look at your loved one Medicare card. Is it original Medicare or is it in Medicare Advantage? Because they have different coverage, they have different benefits. Today, what I want to offer you is a Medicare quick reference guide. It's a one-page, front and back, and what Medicare covers, what it doesn't, the rules around skilled nursing stays, the homebound rule, and the appeal rights that you have. If you ask us for it, you can have it. We'll send it quickly to you. where you can just print it, stick it in your fridge so you can use this as a reference. So reach out to us, send me an email, msoy@Gentle Shepherd Care, or give us a call at 8704 209 5040, and we'll send you the link where you can download this information and you can have it ready for you to use anytime. Now, next week, which is part two, we cover the gaps, the 100-day myth, and the story of a daughter named Rebecca who got the discharge call on a Tuesday and had to figure it all out by Friday. If today's episode raised more questions than it answers for you, that's exactly where we want you to be. The answers will be coming next week. I'm Emma Soy. This is Gentle Shepherd Care, and I'll see you next week.